Okay.
Chicken.
So, similar to at the start of your horse self-assessment, just check to see what their posture's telling you. Are they toe touching? Are they extending the leg? Are they resting it? Are they weight bearing on all four feet evenly? And then when you want to start, just by feeling down the body, so start at the neck. Sometimes horses, if they've tripped and they've fallen, they might have injured their neck. So looking for any swelling. The spine actually starts here and it runs down the bottom there. So this is all muscle, that's the nuchal ligament. So as you're feeling, you want to be feeling down towards the base of the neck. And then you come into the shoulder. So shoulder fractures are rare, but we do see them, especially if the horse gets kicked. So I use the palm of my hand just to feel over the shoulder, and I'm just checking for any pain. And we've got the shoulder joint at the front here. And as we cross over, we've got the elbow joint at the back of the leg. Then we've also got the radius and the ulna, which are the forearms. So I just use my hands just to feel down. I'm feeling for all the muscles. We've got lots of tendons that run down the side of the leg here. And then that bone that I was telling you about, the accessory calf bone that sits in the back of the knee that they can nutcracker, is this one here. So I come down, I just press over the back of the knee, feeling for any swelling, feeling over the joints at the front of the knee as well. And then when we get to the lower limb, this is where we've got lots of really important structures. So obviously the cannon bone sits on this front part. There's a tendon that runs over the cannon bone that you can feel if you move your finger side to side, called the extensor tendon. And down the back of the leg, the three main structures, there are more structures in this, but the three main ones are the suspensory ligaments, which look like this cord that are running down the side of the cannon. And then we've got the deep digital flexor tendon here, and then the superficial digital flexor tendon sits just underneath the skin. So when I'm picking up the leg and I'm feeling down the tendons in the leg, I'm going to feel in these three layers: superficial, deep, and suspensory, because you want to try and isolate which one is the problem. Then over the back of the leg, you're going to have a feel, because there's an important ligament that wraps around the back called the annular ligament here. And then as you're feeling, just down the pattern as well. So just noting any heat, pain, or swelling. Make sure you stop and take your digital pulse. And then I always feel around the coronet band as well. If I've got a horse that's maybe got a brewing abscess, they might get really sensitive around the coronet band. You can check the bottom of the foot for some heat as well. And just have a bit of a squeeze between the heel bolts. So once you've done that with the leg standing, then you want to pick the leg up. Just come to the side of the horse. And I like to, so I'd normally be standing at the front here. To demonstrate this to you, I'll stand further back. So now, these tendons that are running down the back of the leg, they're nice and floppy. So it's going to allow us to have a better feel of them. So, like I said, I'm going to use my thumb, my forefinger, and I'm going to squeeze in those three layers. So I'm going to start superficial to the skin, just underneath. And I'm just making my way down, squeezing as I go, not getting any reaction from the horse. Then I'm going to go about a centimetre deeper. And I'm now feeling along the deep digital flexor tendon. And if you get a little reaction, like if they start pulling away from you, go back and you do it again. Because sometimes the horse might just be a little bit sensitive. And you want to know that what you're feeling is repeatable. So I make sure that I can always get the same reaction in the same spot at least 2 or 3 times before I think it's real. And then once I've done the deep, then I'm going to feel the suspensory ligaments. I'm coming down the middle here, which is great. You can also feel over the cannon bone. So if we're dealing with maybe a really subtle fracture, I'd be pressing all over the cannon bone just to see, can I feel any sensitivity, or can I feel any graininess that might indicate that there's been a bit of a disruption to the bone. And then at the back of the fetlock there are these 2 bones called the sesamoid bones. You can make sure that they don't have any little fractures in them just by getting your thumbs and pressing really firmly on the back. So while I'm there, I then use my thumbs to press over the back of the fetlock as well. So that way we've had a really, really good feel of the leg, with it both weight bearing and not weight bearing. Then we want to test to see whether the joints are painful or comfortable. So I start by getting the foot, I twist it from side to side and flex it forwards and backwards. And then you want to put some flexion through the fetlock joint. So you can do that by getting the horse's heels and trying to pull them towards the fetlock joint like this. Now make sure when you're doing this, you try and keep the leg low. You don't want to be doing this from up here, because otherwise then you're also going to be flexing from the knee. So try and keep the knee relaxed and flex through the fetlock joint there. And then once you're happy, you can let the fetlock completely relax. Let the fetlock completely relax by holding it in your hand, and then you want to try and get the heels of the horse to touch the elbow. So this is going to give you a really nice flexion through the knee while keeping the bottom of the leg nice and straight. And then you can come one higher and really flex up through the elbow and the shoulder. So this will just help you try and localize where the problem might be, you know? And I always do this in the same way in every single horse. Find a system and just repeat it, because that way you can just do it on autopilot. Not having to think about everything. Now with the back leg, everything's identical from pretty much the hock down as it is the front leg. The only things we want to check are the top of the hips here, the pelvis. This part of the hip here is called the tubercoxy. I just give that a really good firm press. I check over the front of the stifle for any swelling. Here's where the kneecap sits. So just give that a good rub. Come down and just check around the hock joints for any swelling, and also behind the hock here. There's a big tendon, the calcaneal tendon, that attaches onto the point of the hock, but there's also these joint pouches here that can get inflamed if you've got an issue. Now when you're flexing the back leg, what you can do to flex the bottom of the leg is just to hold your hand on the toe and just to gently pull it up towards you. That puts a nice right angle here through the fetlock and the bottom of the foot. And then if you want to test the hock and the stifle, put your hands under the fetlock, just like you do on the front leg. Let the horse relax a little bit, and then once they're relaxed, then you can bring the hock up. There we go. She's a little bit reactive to that. Good. Yeah. So she tolerates that pretty well. Now, it's always worthwhile checking both sides, because you want to have a baseline. And anytime I go out and see a lame horse, I actually check the sound leg first, and I check the lame leg last. That way the horse isn't anticipating that I'm going to go and poke it in the sore spot. But also that gives me a general baseline of what is this horse like? Are they really sensitive naturally, or are they dead stoic? So again, it just gives you a good idea. So let's say we've got a tendon or a ligament injury. So you're going to see that in this area at the back of the cannon bone. So most likely from the back of the knee down here, either in one of these three structures, potentially over the back of the fetlock, very unlikely to be in the back of the pastern. And what you're going to be noticing is some swelling. You might even get a bulging in this direction, or you might get a thickening either side, as well as some heat. And this is where it's really handy if you can cool the leg down first and then feel it again. You'll see what heat's left over, because at the moment when they're standing in the sun and when they've been galloping around, it can be quite hard. And then what you're going to want to do is pressure wrap that. So we're going to do a bandage that travels from the bottom of the knee and just covers the fetlock. I'm going to show you that one first. And then we'll do the second bandage, which is the preparation bandage for the Kinsey splint. So I'll grab